Good afternoon, everyone, and thanks for joining us today for our MAMMO for the Masses webinar. As you likely already know, on the call today are staff from PVA and the Department of Veteran Affairs. For those of you that don't know me, hello, my name is Julie Howell. I'm an Associate Legislative Director with the PVA National Office. Let's see. How do I click? There we go. Oops, too far. Quickly, I'd just like to go over some of the logistics for today, especially for those of you that may not have been to one of our webinars before. First, this will be recorded and made available at pva.org. For those of you that might need closed captioning, at the bottom of your screen, you can click the CC button in the meeting controls bar. If you have questions, we ask that you please put those in the Q&A feature, also found at the bottom of your screen. All questions will be answered at the end of the presentation. As I said earlier, we have a lot of staff from VA and PVA that are prepared to answer your questions. I do, however, want to mention that this is primarily an educational webinar, and the MAMMO Act is still a relatively new baby bill. So, we're looking at a high level understanding of what this will be. In the event that you ask a pretty personal question, one of our support staff will probably pull it out of the public facing forum to be addressed so that, all your important information isn't shared all over the place. Lastly, all of the materials presented today will be shared with everybody after the webinar. All right, so now that all that's out of the way, let's talk about MAMMO. Many of you probably remember that MAMMO stands for Making Advances in Mammography and Medical Options for Veterans. In 2019, before the House Subcommittee on Health for the Veterans Affairs Committee, PVA highlighted that many VA facilities lack accessible mammography equipment, which greatly impacts our members. Language from that testimony was written into Section 105 of the bill, which directly addresses accessibility concerns. I'd also like to highlight that the MAMMO Act was a 2022 policy priority for PVA. Members just like you and many of you have been advocating for this bill for a long time, and we're super grateful for all of your efforts. This was signed into law in June by the President, along with the Dr. Kate Hendricks Thomas Service Act, which allows women veterans to access mammography screening if they experience toxic exposure due to a deployment. But I'll leave the rest of that up to the professionals, and one of which we are lucky enough to have with us today, Dr. Erika Scavella. She is currently the Undersecretary for Health for Clinical Services and Chief Medical Officer at the Veterans Health Administration. She's been in this role since January of this year. Prior to her current role, Dr. Scavella served in multiple leadership roles in the Veteran Health Administration, to include, and this is a very beefy title, so I'll try and get it right, Associate Deputy Undersecretary for Health for Oversight, Risk and Ethics, and the Medical Inspector. Dr. Scavella is certified by the American Board of Internal Medicine. She's a fellow with the American College of Physicians and the American College of Healthcare Executives. Dr. Scavella is leading the MAMMO Act implementation efforts for VA, and we are thrilled to have her with us today to explain how VA plans to advance women's health, breast cancer efforts, and accessibility to increase mammography services. So Dr. Scavella, the floor is yours, and thank you so much for joining us.
So Julie, thank you so much for having us here today to talk about this really important piece of legislation. It's also really fitting that we're discussing this month, given the fact that it's October, and October is Breast Cancer Awareness Month. According to the National Cancer Society, breast cancer is still the second leading cause of cancer death among US women. And in addition to that fact, in the US, it is projected that we'll have over 287,000 new cases of female breast cancer diagnosed in 2022. So those statistics are astounding. For this presentation, I would like to share some background and an overview of the MAMMO Act, and then discuss two sections in particular. One, the strategic plan for breast imaging, and the accessibility study and community care accessibility updates, which is really relevant to the audience today. The MAMMO Act was signed into law by President Biden on June 7th, 2022. The law is organized into 8 sections around the areas of 1, breast cancer screening and early detection, and 2, breast cancer partnerships for research and access to care. The Veterans Health Administration is leading implementation of this law in VA. And I will go ahead and go to the next slide, please. So VA's implementation of the MAMMO Act is a collaborative effort with multiple programs within VA working together, including but not limited to our women's health group, radiology, spinal cord injuries and disorders, system of care, oncology, research and development, rural health, and rehabilitation and prosthetics. Additionally, the MAMMO Act addresses partnerships with the National Cancer Institute and the Department of Defense. The MAMMO Act will impact all veterans, both men and women. We expect to impact veterans living in rural areas and veterans with paralysis, spinal cord injury or disorder, or physical disabilities. Members of the armed forces and transitioning service members with breast cancer are also a focus of ours. On the next slide, actually, I can't see the slides, but on the next slide, I'll highlight a few of the key elements of the MAMMO Act and how they impact these groups I just mentioned.
Dr. Scavella, I'm super sorry. Let me make sure that I'm on the right page for the slides because I'm not sure where we should be either.
If you could go one more, I believe it might be 1 or 2 more.
Back or forward?
Forward, excuse me, forward. Yeah, 1 more, forward. Okay, this is where I am. So,
all right, sorry about that.
That's fine. I'll go into more detail later in the presentation about our strategic plan and the mammography accessibility section. But before I do that, I wanted to just briefly discuss the other key areas of the MAMMO Act, and that's what's depicted on this slide. So mammography technology at VA facilities is a focus of ours. The MAMMO Act requires us to upgrade breast imaging services to expand access to digital breast tomosynthesis, also known as DBT, or 3D breast imaging. Many women actually come into their mammogram services requesting 3D breast imaging. That is something that we are making sure we have available. Currently, 69 out of 73 of our VA mammography programs offer that same technology, the 3D breast imaging, and plans are underway to make sure that the remaining sites have that same technology. We will be completing the upgrades over the next 2 years as equipment, staff, and other supporting features are put into place. Our 3-year telescreening mammography pilot is ongoing. We are completing a 3-year telescreening mammography pilot program, which supports VA's goal to provide high-quality mammography screening through remote interpretation of qualified breast radiologists. As you might imagine, we can put equipment in great places, but we want to make sure that we have the specialists necessary to read those images. So we're making sure that we are both expanding access to equipment and ensuring that we have the right professionals to look at those images. The pilot program is expected to expand access to on-site high-quality breast imaging services, including our priority for rural locations where some of these services may not be in existence. We're also doing a study on the availability of and expansion of testing for the breast cancer gene among veterans. This section of the law will support our efforts to increase the availability of access to genetic testing for breast cancer. The results of the study are expected to provide meaningful information around how VA can expand access to genetic testing and counseling. And again, we're also going to focus on rural communities where this technology and this access may not be existing. As part of this section, we're creating a clinical pathway for breast cancer aimed at improving outcomes. We're looking at partnerships with the National Cancer Institute and collaborations with the Department of Defense on breast cancer treatment and research. The MAMMO Act requires identification of potential opportunities for future interagency collaboration between the Department of Defense and the VA. We want to make sure that we're doing that collaboration to increase opportunities and options for treatment, as well as research on breast cancer for our veterans and also members of the armed forces and those who are transitioning from the armed forces to the Department of Veterans Affairs. Additionally, the VA will continue to partner with the National Cancer Institute to expand access to the NCI cancer care and clinical cancer research trials. This is expected to expand access to high quality cancer care for women veterans. Next slide, please. So specifically looking at Section 101, which includes our strategic plan for the provision of breast imaging services, we want to make sure that we have this important tool in bringing together all of the elements of the MAMMO Act that I just described. We also want to make sure that we're addressing other opportunities to advance breast cancer imaging services and breast imaging services for veterans. Our strategic plan outlines the approach for Veterans Health Administration to address the evolving needs of all veterans, both female and male. Our strategic plan is developed on 4 pillars, as you can see. The pillars include quality, access, veteran experience, and outreach. This plan is in alignment with the current VA strategic plan, which is in existence from 2022 to 2028. And the strategic plan identifies timely, accessible, and high quality benefits, care, and services for veterans. It is also in alignment with the direction provided by VA to the Advisory Committee on Women Veterans. We want to make sure that we are following the recommendations of Secretary McDonough and the Veterans Affairs on ways to improve, modify, and affect change in programs and services for women veterans. VA is implementing multiple goals and strategies to address each of the individual objectives of the strategic plan. And our plan is due to Congress in June of 2023. Next slide, please. So going a little bit further, our strategic plan will provide recommendations related to equity and access for breast imaging. This includes addressing any infrastructure needs, any staffing concerns, and the needs of veterans with spinal cord injuries and disorders. We are analyzing its current state, and we are identifying opportunities to better meet the needs of veterans for breast imaging services. VA currently offers mammograms on site at 70 VA facilities. And for those women receiving care at sites without mammography, we are offering screening at community facilities. VA continues to work to ensure care coordination for all breast imaging services for both in-house programs or through community care. We continually review access and criteria to determine if any services need to be expanded. And as shown in this graph, you can see that we've had an increase in the number of services provided to women and men who need breast imaging services. So our VHA mammography program continues to grow, and our population of veterans, including women veterans, has continued to grow as well. Next slide, please. So specifically looking at Section 105, which is mammography accessibility for paralyzed and physically disabled veterans, we want to make sure that we are improving access to services for this population. We want to make sure that we're serving you and making sure that we give you what you need. This section is intended to assess and improve the accessibility of breast imaging services and screening rates for veterans with spinal cord injuries or disorders or other related physical disabilities in VA and in the community. The efforts in response to MAMMO Act Section 105 will ensure that providers of breast imaging services have the equipment and the best practices to provide state-of-the-art, accessible, and equitable care for those veterans as the law intends. There are two main areas of this section. The first is a study on the accessibility of breast imaging services at facilities of the Department of Veterans Affairs for veterans who are either paralyzed or have a spinal cord injury or disorder or another disability. And the second section includes an update on policies and directives to ensure that in referring a veteran with a spinal cord injury or disorder for care from a non-department provider, that we are still making sure that we're meeting the expectations of the law and providing those services. VA is required by law to complete a study and a report on our findings in 2024. And while there's no due date required by law for the updates related to community care, we are going to take that on as our responsibility to ensure that in those instances where we are unable to provide services in-house within VA, that we know exactly what is available in the community. And we're going to make sure that any policy revisions that need to be completed will be completed by next calendar year. VA is underway in planning and designing a section on 105 implementation or Section 105 implementation. Since this is an area of particular interest to PVA, I'll go into a little bit more detail next. Next slide, please. Section 105 allows us to make sure that we're providing this care to veterans in the population of those with either spinal cord injuries and disorders or other physical conditions which limit mobility. Since World War II, we have provided the most comprehensive longitudinal preeminent care for veterans with spinal cord injuries and disorders in the United States. We know that, and we want to continue to be the provider of choice for these veterans. The VA Spinal Cord Injuries and Disorders System of Care offers inclusive, coordinated, lifelong care provided by interdisciplinary teams of experts in 25 regional centers, which we call hubs, and designated local spokes, which are the other 120 medical centers who are not considered centers. We coordinate the care through the centers and the spokes to make sure that we are providing the care that veterans need. In addition to this, VA provides institutional long-term care to veterans with 6 dedicated spinal cord injury and disorder long-term care centers across the system. This is not available anywhere else in the United States. We continue to be uniquely positioned to serve veterans, including in many ways that are not available in the private sector. The care that's offered in the VA, from diagnosis through the entire lifespan, is unsurpassed and remains the only integrated system of care in the nation to provide comprehensive lifelong services for individuals with spinal cord injuries and non-traumatic spinal cord disorders. We'll go to the next slide, and it's a depiction of our services. So this is a bit busy, but if you can take a look at the map, you'll see the blue shapes as well as the red shapes. Those indicate where we have spokes and where we have hubs. Currently, we have 52 on-site mammography, centers that correlate with our spinal cord injury and disorders sites of care. We have a VA Imaging Design Guide, which provides guidance on accessibility design in mammography suites to make sure that as we continue to expand services, we're also making sure that we're providing services that allow for accessibility to veterans who may have some physical disorders or ailments. Our imaging services are in an area with healthcare, within healthcare that is rapidly advancing technologically. So we know that we need to keep up with what's available in the community. The design guide is continually reviewed to ensure that we're providing care that is in alignment with what's happening and what is available in the community. And when necessary, we will change our construction needs to make sure that we're meeting the needs of our veterans. We continue to invest in improvements for women's health. And this includes when our VA mammography programs have determined a need to have enhanced positioning aids with the Office of Women's Health funding. So essentially, if we have a veteran who has a mobility disorder or a physical ailment preventing them from potentially being positioned appropriately, we do have staff members who are trained and educated to assist our mammography teams with ensuring that we're getting the best images during the breast imaging process. We continue to look for ways to improve the mammography experience for our veterans, and in alignment with the strategic plan for breast imaging services for veterans and with MAMMO Act Section 105, future plans include disseminating best practices and providing education on the needs of our spinal cord injury and disorder veterans. Next slide, please. MAMMO Act Section 105 specifically addresses VA's coordination with and referrals to community care providers for spinal cord injury and disorders and physically disabled veterans. VA will continue to partner with the community providers to meet the needs of our veterans. The MAMMO Act requires us to update policies and directives to improve accessibility and care for veterans with a spinal cord injury or disorder in the community. It also requires VA to confirm that the provider has accessible services at the breast imaging site, and also requires us to provide information to the provider on best practices for screening and treating those veterans with spinal cord injury and disorders. So that goes back to what I was just talking about when it comes to positioning veterans who may not be able to be easily positioned for the imaging. We're completing an environmental scan to identify the most feasible course of action to ensure providers are equipped to perform as the law intends in referring veterans to community practice and providers. Next slide, please. So these are some high-level updates on our implementation of the MAMMO Act. We look forward to providing more information as we continue to make progress. I'm glad that we're able to share this information during October and Breast Cancer Awareness Month. The campaign that we are completing and working on will bring awareness to ensure that all women have access to breast cancer screening and the care and support that they deserve and that they have earned. We are here for you. VA is here for you. Every VA facility has a woman veterans program manager and a women's health primary care provider. And often places there are more than one to ensure that we are serving our women veterans in the most appropriate care and treatment. We also have mammogram coordinators who help our patients navigate the breast cancer screening process. And we also have women who have been diagnosed with breast cancer who are able to receive full service oncology treatment. For more information, please call or text VA's Women Veterans Call Center, or you can visit the website at womenshealth.va.gov. We have one more slide for you with more contact information. I want to thank you all for joining this presentation today. Just recall and remember that VA is fully committed to implementing the MAMMO Act and to serving you. We are committed to improving breast imaging services across the system and throughout the community. And we want to make sure that we are providing breast cancer treatment and research to all veterans. We will do our best to answer your questions today, and we'll work with you to meet the needs that you may have. If you have any questions, we ask that you put those in the chat, as Julie said at the beginning of the webinar, and we will be addressing those questions individually. Thank you.
All right, thank you, Dr. Scavella. We are going to go ahead and start fielding some questions from the Q&A feature. As a reminder, if you have a question that you would like asked, please go to the Q&A box and submit a question for us. We have a question from one of our members. Would it be possible for a trigger to be placed on somebody's records to be referred to community care that could pop up and help identify the needs of accessibility when reaching out to a community care provider? This would alleviate being referred to physicians and clinics that do not have the necessary accessibility accommodations.
So good afternoon. I think we're going to make sure we speak with our electronic health record implementation team to see if that is a feasible solution and then get a definitive answer back.
Great, thanks. I know that it wasn't something that you highlighted in your slideshow, but I was wondering if you might be able to briefly give an overview of what the goals are of the telemammography program. I know that a couple people are sort of scratching their head about what that might be, and I think explaining that to folks might be very helpful.
So I do have a team member who has more expertise in this area, but I can open up and then hand off to them. So the idea behind telemammography is that we don't necessarily have radiologists in every single location across the country to provide that expert service. So by using telecare, telehealth, we're able to gather the information and then have an expert take a look at the images and provide that expert review. I'm going to go ahead and see Dr. Malloy. If you would like to add to that, thank you.
Yes, thanks, Dr. Scavella. Yeah, Patrick Malloy, Executive Director, National Radiology Program. Yeah, as Dr. Scavella said, yes, what we'll plan to do is try to expand access at our to on-site imaging through the use of telescreening mammography, where we'll be able to perform the examination at the facility at a convenient place for the veteran and have high quality subspecialty trained radiologists who will be in remote locations who will be able to provide the interpretation where they wouldn't be able to be on site. We're hopeful that this will expand access and also also improve the patient experience.
Great, thank you. I'm wondering if you might be able to address how MAMMO might be beneficial in assisting rural veterans who may not have as much direct access to a VA medical facility.
Sure. So again, that's one of the opportunities for potentially for telemammography, because we don't want folks who've chosen to live in a non-urban area not to have the same accessibility to care. So we want to provide different services in a creative way. The pandemic honestly made us look at how we're providing care across the country. So that is one service. We want to make sure that rural veterans are getting every benefit of having served and this country. We want to make sure we're providing them with every service that they can possibly have. So telehealth will potentially leverage that. Also, there are places where folks do choose to live and have been willing to move to. So also encouraging those specialists to look into some of those other locations to live and to practice is something else we're looking into.
Great, thank you. We have one in the chat that says, thank you, Dr. Scavella, for this presentation and for your commitment. Will you have women veterans who live with paralysis or other disabilities involved in the implementation of the MAMMO Act to ensure that it actually is accessible?
I am certain that we will be getting feedback from our stakeholders, and you're the most important stakeholder group. So yes, we are not doing things in a vacuum. I believe that did anyone else on our team want to add anything to that?
Yes, Dr. Scavella, yes. Part of one of the goals of the work streams is to conduct a survey of women veterans, of our paralyzed veterans for their previous experience and incorporate that into our recommendations.
Great, and somewhat as a follow-up to that, if possible, as you can imagine, our audience is very interested in accessibility among community care providers. Has that been discussed as part of the upcoming strategic plan, as part of the accessibility understanding, ensuring that if a veteran is referred to the community, that they actually have accessible screening equipment?
So, as I did present, that is something that we're working on. And not only are we going to look into that to make sure that our community partners are able to provide those services, but also we're going to report back on it because we think it's important enough to report on, to include in our action plan what we're going to do to partner with the community partners to make sure that we're providing those services. Accessibility is a huge concern, and rightfully so. So we need to make sure that we're providing, giving the expertise to our community partners, not just leaving them out there to try to figure it out on their own, especially as we know what works and what assistance to provide.
Good, we appreciate that. I know you talked a little bit about timelines in your presentation. I'm sure, as you know, most veterans are curious, when will we see something? So beyond the strategic plan, the 2024 execution of that, do you maybe have a sense of when VA users might see changes in their facilities or an execution type timeline?
So I am going to hand this one off to Dr. Malloy, but I'll just start by saying that a lot of these services are already available at certain locations, and we're looking to see where the gaps are between what the bill requires and what we would like to get to. But again, I don't want to speak on behalf of Dr. Malloy, so I'm going to go ahead and turn it over to him.
Yeah, thanks so much. Yes, and this is an ongoing effort from the National Radiology Program in conjunction with spinal cord injury, neurology, and the amputation system of care that we're working with. And there is a 2-year timeline that we're looking at for to do this evaluation and to make and implement recommendations. We're on track to keep within that, and maybe be a little bit earlier. As was mentioned before, in particular, there is going to be a focus on making sure that the accessibility is the same in the community as it is at our on-site facilities, and that's going to include both of our updating of our policies and procedures, and making sure that all of our sites of care have the appropriate infrastructure, meaning equipment and physical layout to accommodate patients, paralyzed patients and those with disabilities appropriately, but also to make sure that our staff have the appropriate knowledge and expertise, and we're able to spread best practices over to them to make sure that we have a uniform and an optimal patient experience. And that's our goal, and we hope, and I'm sure with our team we'll be able to achieve it.
Great, thank you for that. I just want to double check. Anyone else got any questions? This might be the fastest webinar ever. And the quietest. I don't see any other questions coming in. I'm going to give it just a few more seconds. In the meantime, thank you everybody that has called in to listen. Thank you to VA for providing, as we can see on the screen, several subject matter experts that were here and prepared to answer any questions that may have popped up. Thank you to the PVA staff that have also called in and offered support. As a reminder to everybody, this has been recorded. This, along with the slideshow, will be sent out to everybody probably within the next week or so. As always, if you have any questions, you can feel free to reach out to the national office, and we will get back to you. As far as I can tell, I think that might be it. Again, thank you everybody for hanging out with us this afternoon, and I hope that this has been informational for you. So I guess that's that.
Thank you so much.
Thank you, Dr. Scavella and Dr. Malloy.